Hello, my name is Barbara Brookins and I'm the president with the PEI Nurses Union. We're here today to talk about a staffing crisis in the Prince County Hospital Emergency Department. Health PEI is failing to recognize the current and upcoming shortages of registered nurses within the healthcare system, and now the RNs are paying the price. High number of vacancies and poorly laid out processes for hiring need to be addressed, and an actual plan set in place to ensure that the staffing levels will support service delivery. Unfortunately, Health PEI is in this position because they had not addressed the RN shifts that are still vacant over the coming summer. They will now have to replace RN positions with other healthcare professionals. We have just heard that Prince County Hospital has hired paramedics to fill registered nurse positions. Another example of privatizing the health services and Health PEI paying more money to hire staff that already should be a part of the healthcare system. This is very concerning. At a minimum, a new RN has a Bachelor of Science degree in nursing that requires 4 years of study and clinical experiences focusing on all aspects of patient care. In comparison, the 2-year primary care paramedicine program is highly focused on pre-hospital emergency care. A paramedic's training is on the administration of a very select medications used in specific emergency situations. The training for a registered nurse incorporates pharmacology and medication administration throughout the 4-year program. More strain will be placed on registered nurses through the training and fulfilling of duties that are unable to be performed by other healthcare providers. The emergency room is not just an emergency room anymore. With large numbers of patients being held for days while waiting for a bed in the hospital, the department is often operating as a department within a department. Mental health patients may be held in the emergency department for days, waiting for psychiatric assessment, and also waiting for access to community services. And this could now be provided by paramedics who do not have a focus on mental health training in their program. Many tasks performed by a registered nurse are not transferable. A registered nurse is irreplaceable. Taking resources from one fragile health system and putting it into another is not solving the problem. We ask you to recognize the toll that this is taking on the current registered nurses. Moving forward, we need to ensure that there is a long-term plan in place to address the recruitment and retention of this vital health human resource.